I'm so happy to hear and invite Dr. Lomis to come here to show us the good topic about the single compound of many Chinese herbs in clinical and in laboratory use. And I introduce the Dr. Lomis. He is the postdoctoral researcher, cardiovascular and mitochondria-related disease research center of Hualien Shiji Medical Center. Now he is going to present the topic about by setting attenuate doxorubicin-induced cardiotoxicity by inhibiting the insulin-like growth factor 2 receptor apoptosis pathway through estrogen receptor of alpha and beta activation. Now, welcome Dr. Lomis.
Thank you, Professor, for your kind introduction.
Okay, thank you.
Thank you. Shall I start?
Yeah, okay.
So, very good evening to all of you, professors. So, I am here to present my work entitled on quercetin attenuates doxorubicin cardiotoxicity by inhibiting the IGF-2R alpha receptor apoptotic pathway through estrogen receptor alpha and beta activation. So we all know very well that doxorubicin is a chemotherapeutic agent and it has been used to treat variety of cancers. However, its cardiotoxic side effects limits its therapeutic efficacy. By the time quercetin is a flavonoid phytoestrogen and it is being extracted from variety of vegetables and fruits. So a number of reports stating that it has been protective effect of quercetin against doxorubicin induced cardiotoxicity by inhibiting the IGF-2R receptor pathway. So the present study has been undertaken to evaluate the protective effect of quercetin. So here you could be able to see the chemical structure of quercetin. The solubility of the quercetin in DMSO is 30 microgram per ml at 25 degrees Celsius. So the quercetin is a phytoestrogen, as I told you earlier that it's a natural polyphenolic compounds and it can bind to estrogen receptors, that is shortly called as ER, and it imitating the conformational shape of estradiol act as a estrogen agonist and regulated genes. A few Chinese herbs exhibit phytoestrogen activity which inhibits IGF-2R expression and protects cardiomyocytes. Here I would like to say that what you mean by IGF-4? IGF-4 is a protein. Actually, the activation and the overexpression of IGF-2R alpha leads to cardiac damage or cardiotoxicity. So here in this study we use quercetin as a protective agent to act against the cardiac toxicity. So it has, the previous report already showed that quercetin has anti-cancer and anticoagulatory and anti-inflammatory properties, and it also protects against oxidative stress related disorders such as diabetes and cardiovascular diseases. So our hypothesis is to determine whether quercetin attenuates cardiotoxic by inhibiting IGF-2R via estrogen alpha and beta or CYP or HS1 signaling pathway. If you take here, if you see in this pathway, in the normal red hearts, HS1, this is a heat shock growth factor. It suppresses IGF-2R expression to protect red hearts. If you see here, actually in normal conditions, HSF1 binds to its DNA binding site, that is heat shock element HSE, in the IGF-2R promoter region to suppress IGF-2R expression. Thus, HSF1 protects rates caused by blocking IGF-2R induced apoptosis. Here, whereas in the case of doxorubicin treatment, it increases IGF-2R accumulation, which leads to apoptosis through destabilizing HSF1 and SIRCH degradation by ubiquitination. Subsequently, HSF1 cannot bind to IGF-2 promoter region, inhibiting the expression. Finally, our phenomenon enables that visitin to diminish DOX-induced cardiotoxicity in ovary-optimized heart rates through estrogen receptor to activate CHIP and SIRT-mediated HSF1 nuclear translocation to block the IGF-2R apoptotic pathway. So here we could able to see the MTT result. Actually, to study the protective effect of visitin against doxorubicin cardiotoxicity, we used various concentration of visitin and cardiomyoblast cells, that is H1C2, H9C2 cells, and assessed by MTT assay. Here you could be able to see that up to 50 micromolar of visitin is not having any effect on the cell viability of cardiomyoblast cells. But whereas doxorubicin treatment, it has dose dependent decrease in cell viability. So here we could be able to see that IC50 was found to be 1 micromolar of doxorubicin. So same time we also studied the time dependent effect on 1 micromolar doxorubicin. Here you could be able to see that time dependent cell viability is decreased. So at the same time we wanted to study the effect of visitin on DOX induced cardiotoxicity. Here you can able to see that visitin recovered or rescued the cell viability DOX induced cardiotoxicity in this cell line. So from that we can the 50 micromolar of visitin is fixed for further study. So to study the survival potential or protecting effect of visitin, so we studied the ER markers as well as phospho-AKT survival markers and other markers using Western blotting. So here the treatment of visitin 10 to 50 micromolar increases the ER expression. You can able to see here, as well as the survival markers like phospho-AKT as well as BCL2. But whereas in the case of IGF-2R, that is apoptotic role, it has apoptotic role, the expression is found to be decreased when the treatment of given to the cell lines. So from this we could be able to see that ER, that means the estrogen receptors, they increase the expression when we treat the visitin. So based on that, further experiment was conducted by us. So in this Western blotting, the visitin was co-treated with the doxorubicin. Here also the doxorubicin treatment decreased the ER expression as well as the phospho-AKT as well as BCL anti-apoptotic proteins. But whereas in the case of BAX, the doxorubicin treatment, the expression of BAX is increased as well as in cleaved caspase that apoptotic proteins. But in case of treatment with visitin, it's all the apoptotic proteins are found to be decreased, but whereas in the case of estrogen receptors increased. So through that it has visitin has a protecting effect in this study. So as well as we also studied phospho-NF-kappa as well as antioxidant markers. Here the visitin treatment along with doxorubicin increased the expression of SOD, that is antioxidant, as well as decreased the effect of phospho-NF-kappa. always there is a negative correlation between phospho-NF kappa P as well as SOD. So further, we also treated with our cell lines along with ICI, that is estrogen antagonist. It always it's like antagonist. It always act against to the estrogen receptor. Here you could able to see that the treatment of ICI decreased the expression of ER alpha, ER beta as well as phospho-AKT and CHIP and other proteins except IGF-2R as well as cleaved caspase 3. So from that we could able to know that IGF-2R expression is increased when ICI treated. So likewise, the doxorubicin treatment also reduced the expression level of ER and other proteins except IGF-2R as well as cleaved caspase. Whereas in case of the treatment along with piscitine, it rescued the survival potential of IGF-2R as well as cleaved caspase. Here and also ER as well as phospho-AKT as well as CHIP protein. So further, we also further confirmed with the tunnel assay. Here also the apoptotic cells were higher, found to be higher in ICI as well as doxorubicin treated cells. But whereas in case of piscitine, it rescued the protective effect against the DOX-induced cardio-apoptosis. Further, we also used OVX, that means ovary optimized rate model for this study. Why we use OVX rate means actually the post-menopausal stage, it decreases the estrogen receptors. We want to know that whether piscitine is bind upon the estrogen receptors like ER and it increases or it gives protective effect against DOX-induced cardiotoxicity. So we used OVX rate model. Here we totally 16 weeks we have we had a experimental protocol, and if you look at the survival of the rates, piscitine treated animal model has good survival rate, and also this seems to be like ECG echocardiogram. We also studied so many parameters like left ventricle EF as well as FS and systolic or diastolic parameters. Here we could be able to see that when compared to the DOX group, piscitine group has decreased the damage in this animal study, whereas in case of all parameters, piscitine has a protective role. And in addition to that, serum biomarker is an important parameter for cardiac damage. So we also studied serum LDH, serum CK and other parameters, CM AST. So here we could be able to see that when compared to the doxorubicin treated group, piscitine rescued the damage in all other groups. So we used over-optimized rate in this animal model. In addition to that, these are all the cardiac characteristics among all the groups like DOX as well as over-optimized group as well as DOX plus OVX and along with piscitine groups. Here we could be able to see that all the parameters, if you look at this body weight, like OVX rates, because it contains more body weight because of the hormonal regulation, and LVW TPR length are also found to be lower in DOX as well as OVX treated rate model. So these are all the parameters. These are all the ECG, that means echocardiographic assessments. So here also, if you look at the piscitine treated groups, it contains the protective role. If you look at the statistical values, there is a statistical difference between among the DOX treated OVX rate model as well as piscitine treated OVX model. So further, these are all the antioxidant markers. That is the key markers because it contains whether it has antioxidant effect or oxidative stress renewable effect is available or not. That is what our aim, along with the cardiotoxicity. Here, if you could be able to see that that MDA, GSE, SOD, CAT, these are all the enzyme markers. So antioxidant enzyme levels. If you look at the doxorubicin and ficitin treated animal groups, that means it contains the lowest MDA level as well as higher GSS level. That means it shows that the results show that the ficitin showed the protective level against the DUX-induced cardiotoxic in rat models. So here we could able to see the Western blotting. That means the protein expression levels of as well as the histopathology, that is H&E staining and the tunnel assay. Here you could be able to see that there are different groups. So in that we have screened the IGF-2R as well as SIRT estrogen receptor, CHIP and other apoptotic and anti-apoptotic markers. If you look at this result, you could be able to see that DOX groups, I think the level of IGF-2 levels are higher in DOX group. Even compared with DOX plus OVS groups, that means this group expressed more IGF-2R alpha. So that means there is a cardiac toxicity. But in case of ficitin treated groups, the expression pattern is reduced. So like that, even if you look at the HSF1 and other markers except this apoptotic proteins, all tend to have the similar trend. So from that we could be able to know that ficitin attenuates the induced cardiotoxicity through IGF-2R apoptotic pathway. So here you could be able to see the apoptotic markers. Here also the same trend is obtained. Here you could be able to see that the ficitin treated the group has showed more apoptotics. That means really it has a protective role. So that is what I conclude from this study. And also the tunnel assay also is indicated that DUX plus OVX plus ficitin treated groups contains less apoptotic cells when compared to the control. So same way the histopathology, that means H&E staining, you can able to see that DUX plus OVX group has more fibrosis, like myofibrillar fibrosis, and whereas in case of ficitin treated groups, it has less. That means it rescued the fibrosis level in this study. So finally, I would like, because this is very vast area, I think this is 1 year work I am simply explaining within 5 to 10 minutes. So I don't know how other people can understand about this, but at the maximum I'm trying to explain. But my conclusion is the finding of this study demonstrated the novel mechanism by which the flavonoid phytoestrogen, that is ficitin, whether it alleviates DUX-induced myocardial injury as well as oxidative stress and improves cardiac function. And this is the first study in our lab that showed ficitin, protective effect of ficitin against DUX-induced cardiotoxicity. We conducted both in vitro as well as in vivo model. So finally, our research suggests that ficitin may be a cardioprotective drug for cancer treatment, particularly in post-menopausal women undergoing doxorubicin anthracyclosis. So this is like 1 year and 6 months of work. Finally, we tried the phytotherapy research. I only communicated these papers. So in April 2023, it got accepted. The impact factor is 7.2. It's Q1 ranking. So thank you for your patience.
Okay, many thanks for Dr. Lomis to show us the important single compound of quercetin to reduce the risk of doxorubicin-induced cardiotoxicity of today's study. Okay, is anyone have the problem or comment about today's herb study? Okay, we know that the vicinity is the favorite flavonoid compound found widely in many fruit and vegetables. And I have a question for Dr. Lomis. What kind of fruit or vegetable is vicinity is widely in the vegetable or fruit?
Yeah, actually in apple, the compound is more apple, strawberry.
Strawberry.
Yeah, apple,
okay.
strawberry, and orange.
Oh, orange.
Yeah, in case of vegetables like cabbage.
Oh, cabbage.
Yeah, cabbage and cauliflower.
Okay.
And even potato.
Oh, potato.
Yeah.
Okay.
Yeah, there are a number of studies are available in this compound. But our novel thing is our lab, our professor only found out that IGF2 or alpha pathway. So we conducted many studies in this pathway. So we applied this pathway for using this compound. Okay. We got very good result. Finally, it got accepted in very good journal. Yeah, it's top peer-reviewed journal. So very recently, our paper got accepted. Okay, so if the cancer patient receive the doxorubicin to treat their cancer, they may take a lot of such as the onion, actually,
berries.
The doxorubicin is a anti-cancer drug. Yeah. But actually, what happened is when we take anti-cancer drug, the heart will be affected. Oh, okay. So we are not targeting cancer. So when cancer patient they take doxorubicin, their heart will be affected. So we are going to treat heart for cancer patients. Oh, okay. Yeah, and especially the estrogen level. Actually, the women, especially after 40 years of age, the menopause, the periods will stop. So there will be a hormonal imbalance. They will have more chances to get a heart problem. Yeah. So quercetin is a phytoestrogen. It contains phytoestrogen flavonoid. So if you take flavonoid, quercetin, it will replace the hormone imbalance. So it won't affect heart. That is the ultimate answer. We use cancer drug for heart problem.
Yeah. Okay. Yes, sir. Thank you for Dr. Romi's comment. Yeah. Good question and
yes, sir. Yes, sir.
Good conclusion.
Yes, sir. Yes, sir.
Okay. Is anyone have a problem or a comment? Okay. Oh, okay. Hi. The Professor Lai. Nice to meet you. Do you have
nice
a suggestion or comment about today's?
I have
Okay,
two
Professor
questions.
Lai.
I have two questions to ask the doctor. I would like to ask fixactin is a flavonomolecular. Which plant is the isolated from in these studies, and the daily dose of the fixactin. Are there animal data showing the efficacy and the dose safety?
Actually, sir, thank you for your question, sir. Actually, quercetin is available in many vegetables and fruits, but this is pure compound we obtained from Sigma, sir.
Okay.
It's a pure compound. We didn't isolate this compound from the fruits. We obtained the pure compound from the commercial offices.
Okay. And my secondary question is the daily dose of the fistatins. Are there animal data of showing the dose efficacy and the dose safety?
Yes, sir. Yes, sir. Yes, sir. We screened like dose-dependent manner, sir. Actually, this is not our first study in visiting. We already we had optimized everything in our previous study. But for cell model, 50 micromolar concentration is the it gives good result. So we selected 50 micromolar concentration for cell model. 5 mg per kg per body weight is selected for animal experiments, Professor.
Okay, thank you.
Thank you, Professor, for your...
Thank you for the Professor Lai's question and comment. Thank you. Okay, is anyone have a question about today's herbal study? Okay, if there is no question, we have come to the end of today's virtual TCM webinar meeting, and the next TCM case discussion will be set on the November 23rd. And thank you for coming here today's participation for everyone, and wish you have a nice day. See you later. Bye bye. Thank you. Bye bye.
Bye bye.